afternoon.
Hi, good afternoon.
My name is Maria and I'm a student nurse at Laredo College, and today I'll be instructing you on how to do deep breathing and coughing exercises. Is that okay?
Yes.
Okay, can I have your name and your date of birth?
My name is Lori Gonzalez, May 27, 1998.
Okay. And how are you feeling today? Is everything okay?
Yes, everything okay.
Okay. To begin the deep breathing exercises, we will begin by having you sit up straight in the upright position, and then I will be instructing you on demonstrating on how to perform this exercise. So first we will begin by taking a deep inhale and then releasing with the mouth using the lips. So it would go something like this. Okay?
Okay.
Again. Okay, and one more time. One more time. Okay, so for the following exercise, it will consist of you taking a deep breath and holding it for 3 seconds. So you would inhale through your nose, hold it while I count for 3 seconds, and then release with the mouth.
Okay.
Okay? So if you want to begin, hold it. 1, 2, 3, release. Okay, and now one more time. Hold it. 1, 2, 3, and release. Okay, perfect. The final step of this breathing exercise consists of taking a deep breath and coughing twice. For example, like this. So you inhale through your nose. Like that. Okay?
Okay.
Before instructing the patient to perform her breathing exercise for the coughing portion, if the patient was out of surgery, then we would instruct the patient to place a pillow in her front chest area in order to provide comfort and alleviate if any pain is associated. Okay, go ahead. Okay, one more time. Okay. After performing these breathing exercises, especially this one that required coughing, did you experience any pain or did you feel uncomfortable while coughing?
No, everything was okay.
Everything was okay? Okay. If the patient has been out of surgery, then it is recommended to perform these exercises 3 to 5 times in an hour during the recovery process.